Hello friends, welcome back to my YouTube channel. In this video, I am going to explain you the some important concepts or some important questions which are going to ask you in the examination in the Pharmacology 3. So in Pharmacology 3, Unit 1, it includes two chapters, that is respiratory system and the drugs acting on the GIT tract. So in the respiratory system, they are going to arise the questions for 5 marks concepts. In the 5 marks concepts, 5 marks questions they are going to ask you in the first chapter. In the drugs acting on the GIT tract, they are going to ask you the 10 marks questions, and in 2 marks questions they are going to ask you 2 questions. So from the respiratory system they ask you 1 question, and from the GIT tract they are going to ask you 1 question. So in the chapter 1 respiratory system, they are going to ask you the definition of bronchial asthma and its classification. So the classification will be anti-asthmatic drugs. So this question may ask you for the 5 marks. Then pharmacology of agonist and xanthine. In the syllabus copy it is there. The xanthine pharmacology is asked for the 5 marks question. And the difference between the antitussive and expectorants, they may ask you for the 2 marks or the 5 marks, the differences, and individually they may ask you the what is the uses of antitussive drugs, what is expectorants, give its uses, like that they are going to ask you. The respiratory stimulant pharmacology also asked for the 5 marks. For the 2 marks they ask the respiratory stimulants drugs example, what they are going to ask you. The nasal decongestant, that they are going to ask you for the 5 marks, its mechanism of action. In 2 marks they asked what is nasal decongestant and its example for the 2 marks. And in the 10 marks they are going to ask you the classification of anti-ulcer agents, that is proton pump inhibitors, mechanism of action and uses, and H2 blockers. And another one important thing is omeprazole, mechanism of action and uses, or the pharmacology of omeprazole, they may ask you for the 10 marks. And purgatives and laxative classification, mechanism of action, uses, they are going to ask you for the 10 marks. And domperidone pharmacology, they are going to ask the drug, its pharmacology. Then they are going to ask you the antacids classification and its uses. For 2 marks also they may ask. And emetics for 10 marks, they asked you for the 10 marks, its pharmacology and mechanism of action you have to write. It is an important concept in the unit 1. So let us discuss now about the unit 2. So in unit 2 the antibiotics will comes. So the antibiotics mechanism of action and the concept of antimicrobial resistance, for 5 marks they asked in the examination. And for another tetracyclines and aminoglycosides are important, its mechanism of action and pharmacology they may ask you in the exam. And the drugs which I have mentioned, that also important, they may individually they may ask you the drugs mechanism of action. And then classification of penicillin, it is very important for 10 marks, and mechanism of ampicillin is asked individually. And sources and mechanism of action and adverse effect of tetracycline is asked for the 10 marks. Next, unit 3. In unit 3 they are going to ask you the 10 marks concepts will be like anti-tubercular classification, mechanism of action, adverse effects, uses, you have to write that. Then anti-malaria, anti-amoebic agents, antiviral, anti-helminths, antifungals. It is very important concepts for 10 marks concepts it is. Then in 5 marks concept, individual drugs mechanism of action they are going to they are going to ask INH, rifamycin, chloroquine, triazole, zidovudine. So these are the important drugs. They are going to ask its mechanism of action, uses, adverse effect, pharmacology. They are going to ask. Next, from 2 marks, they are going to ask the what is leprosy and dots types, malaria parasites. They are going to ask the 2 marks concepts will be like this kind of questions will be there. And from the unit 4, unit 4 is usually for 5 marks questions. From unit 4 and 5 marks questions will 5 marks and 2 marks questions only arise. So cell cycle plasmodium species, cell cycle of plasmodium species, they are going to ask you for 5 marks. Immunostimulants and immunosuppressants, cyclosporin, corticosteroids, mechanism of actions, adverse effect, uses, they are going to ask. And cause UTI, STD, alkylating agents, about that they are going to ask. And in 2 marks questions, they always ask the causative agents for the STD. This is like that they are going to ask you. And next, methoxyrate, they are going to ask its mechanism of action, uses, and adverse effect. And from the unit 5, last unit in the pharmacology, in that they are going to ask you about poisoning, barbiturates, lead and mercury, arsenic poisons, antidiodes definition, what is antidiodes, give example. They are going to ask you like that. Acute and subacute chronic toxicity, carcinogenicity, mutagenicity, chronopharmacology, chronotherapy, definition of rhythm for the 2 marks, chronotherapy definition 2 marks, chronopharmacology definition 2 marks. From the poisoning they are going to ask you for the 5 marks, and acute chronic toxicity for 5 marks, carcinogenicity and mutagenicity for 5 marks arising questions. From the definitions will be like a definition of rhythms. These are the questions for the 2 marks. This is all about the pharmacology 3 important questions. Thank you.